The illusion of the increase. 75 million Americans just received news that sounds good. The Social Security Administration announced a 2.8% increase in benefits for 2026. On average, this means $56 extra per month. $56 that could make the difference between paying the electric bill or not, between buying medications or not, between eating decently or not. But there's a problem so big, so calculated, so systemic that most people won't even notice until it's too late. And when they do notice, the money will have already disappeared from their accounts. The 2.8% COLA isn't what you think. And what you don't know about this number could destroy your 2026 budget. Let's start with the facts. The cost of living adjustment, known as COLA, is the annual adjustment Social Security makes to try to keep benefits aligned with inflation. The idea is simple. If prices go up, your benefits should go up too. Sounds fair, right? In October 2025, the government announced that the COLA for 2026 would be 2.8%. This is slightly higher than the 2.5% from 2025, but much lower than the massive increases from previous years. In 2023, the COLA was 8.7%, the highest in 4 decades. In 2024, it was 3.2%. Now we're back to normal numbers. For the average beneficiary receiving about $2,000 out of $15 per month, this 2.8% increase means approximately $56 extra. For couples, the average increase is $88. These new amounts start appearing in January 2026 checks. So far, everything seems reasonable, but this is where the story starts to get dark. COLA is calculated using something called CPI-W, Consumer Price Index, for urban wage earners and clerical workers. This index measures price changes in a basket of goods and services that urban workers buy. The government compares third-quarter data from the previous year with third-quarter data from the current year. The difference is the COLA. Here's the first problem. CPI-W tracks young urban workers, people who are still in the workforce, people who spend money on commuting to work, on professional clothes, on child care. But who receives Social Security? Retirees, people who no longer work. And you know what retirees spend money on that workers don't spend as much? Health care, medications, medical care, home assistance. According to the Kaiser Family Foundation, seniors on Medicare spend 13.6% of their income on healthcare-related expenses. That's more than double what younger people spend. But CPI-W doesn't adequately reflect this. It underestimates how much healthcare costs actually weigh on a retiree's budget. AARP has been advocating for years that the government should use CPI-E, a specific index for Americans aged 62 and older. This index gives more weight to medical costs, which are precisely those that grow most for seniors. But Congress continues to ignore this. So, from the start, COLA is already calculated using an index that doesn't represent the financial reality of those actually receiving the benefits. But the problem goes far beyond that. Far beyond. While the government was announcing the 2.8% COLA, there was another number being projected behind the scenes, a number that very few people paid attention to, a number that will devour almost half of your increase. The Medicare Part B premium for 2026 is projected to rise to $206.50 per month. That's an increase of $21.50 compared to the $185 from 2025, a jump of 11.6%, almost double last year's increase. Let that sink in. Your Social Security benefit goes up $56, but your Medicare premium goes up $21.50. Suddenly, you don't have $56 extra anymore. You have $34.50. Medicare just ate 38% of your increase. And for many people, it's going to be even worse, because Medicare Part B is automatically deducted from your Social Security check. You don't even see this money. It disappears before it reaches your account. There's a rule called the hold harmless provision that supposedly protects beneficiaries. This rule says that increases in Medicare premiums cannot reduce your Social Security check below what you received the previous year. Sounds great, right? But there's a giant problem. This protection only applies if you were already enrolled in Medicare Part B the previous year and if you have your premiums automatically deducted from Social Security. If you're new to Medicare, if you pay your premiums separately, if you have high income and pay ERM-AA, you're not protected. And even for those who are protected, it doesn't mean you're making money. It just means you won't lose. Your check will stay exactly the same as last year. Zero real increase, while everything around you gets more expensive. Inflation hasn't stopped. In September 2025, annual inflation was at 3%. That's higher than the 2.8% COLA. You're already losing purchasing power before even considering Medicare. But let's go deeper, because there are other medical costs nobody's talking about. Medicare Part D, which covers prescription drugs, is also changing. The maximum deductible for 2026 is projected to rise to $615, an increase of $25 from the $590 in 2025. Doesn't sound like much, but for someone dependent on multiple medications, every dollar counts. And there's more. Home care costs for seniors rose 11.6% in just 1 year. Medical services rose 3.9%. These are numbers well above general inflation and way, way above the 2.8% COLA. If you need home assistance, if you need durable medical equipment like wheelchairs or walkers, if you need regular therapies or treatments, you're seeing cost increases that easily exceed 10%. Your 2.8% COLA? It's a joke. Here's a statistic that should shock everyone. The poverty rate among elderly Americans rose to 15% in 2024. That's an increase from 14% in 2023, and it's the highest rate among all age groups in the country. Let that sink in. Seniors, the people who worked their entire lives and contributed to the system, now have the highest poverty rate in the country, and it's getting worse. AARP reported that more older adults are struggling with rising housing and utility costs. Rent is rising faster than COLA. Electricity is rising faster than COLA. Gas is rising faster than COLA. Food is rising faster than COLA. And the government responds with 2.8%. Let's look at a real case. Sam Ciraulo, 68 years old, retired adjunct professor in Sacramento, California. He lives on approximately $1,400 per month from Social Security and food stamps. The 2026 COLA will increase his benefit by about $40. But Sam has a rare neurological disease that requires him to keep his home cold. His electricity bill is high, very high. He already depends on nonprofit organizations and religious groups to help pay his utilities. But these organizations are running out of resources. Many have closed. When Sam sees his electricity bill every month, he needs to decide what to cut. Food, medications, he needs to seek help, and help is drying up. The $40 COLA increase? He thinks half will go to the Medicare premium increase, $20 left. $20 to cover increases in electricity, food, transportation, everything. $20 doesn't even buy a tank of gas. Or consider Joyce Clark, another retiree. She says that annual COLA adjustments don't even come close to covering increases in gas, rent, groceries, and electricity. Last year's COLA was completely consumed just by the rent increase. These aren't isolated cases. These are representative of millions of elderly Americans who are seeing their benefits evaporate in the face of real living costs. Now, let's talk about timing. COLA is based on inflation from July, August, and September of the previous year. This means the 2026 COLA reflects mid-2025 prices, but you'll receive this money in 2026 when prices have already risen more. There's a lag, a delay. You're always chasing, never catching up. In 2022, for example, the COLA was 5.9%, but inflation that year reached 9%. Beneficiaries lost purchasing power massively. The 2023 COLA was 8.7% to compensate, but by then, many people had already exhausted their savings, had already gone into debt, had already made impossible choices between food and medicine. And now, with inflation at 3% and COLA at 2.8%, we're back to the same dynamic. You're losing ground. Slowly, but losing. Some economists are predicting that inflation will continue rising in 2026, driven in part by higher tariffs on imported goods. If this happens, the 2.8% COLA will seem even more inadequate. Cars, home construction, toys, electronics, everything could get more expensive. And you? You'll be stuck with a 2.8% increase that was already insufficient when it was calculated. The Senior Citizens League said the 2026 COLA will hurt seniors. Executive Director Shannon Benton argued that COLA needs to be strengthened. He pointed out that the Census Bureau estimates about 10% of Americans of retirement age live in poverty, but their research suggests the number may be even higher. Year after year, they warn that Social Security increases aren't enough, and year after year, Congress does nothing. So, let's recap what really happens in 2026. You receive a 2.8% increase in your Social Security. Looks good on paper, but then Medicare Part B rises 11.6%, eating 38% of your increase. The Part D deductible rises. Home care costs rise 11.6%. Medical services rise 3.9%. General inflation is at 3%, higher than your COLA. Housing continues to rise. Utilities continue to rise. Food continues to rise. In the end, you didn't get an increase. You got an illusion of an increase. You're running faster just to stay in the same place. And for many, you're actually losing ground. And here's the most perverse part of all this. The system was designed to appear helpful. The government announces COLA with great fanfare. We're protecting seniors. We're adjusting for inflation. But they know Medicare will rise. They know CPIW doesn't reflect the real costs of seniors. They know there's a timing lag. They know all of this. And yet they make the announcement as if it were a victory. The truth behind the numbers. 40% of elderly Americans depend on Social Security as their primary source of income. 40%. These aren't people who have large private pensions, robust investments, or substantial savings. These are people who count on that monthly check to survive. For these people, COLA isn't a bonus. It's literally the difference between having a roof over their head or not, between eating or going hungry, between being able to pay for medications that keep you alive or having to choose which ones to take and which ones to skip. And the government is giving them 2.8%, while taking almost half back through Medicare. Let's talk about what it means to live on fixed income when everything around you is getting more expensive. Imagine you receive exactly $2,015 per month. That's the average Social Security benefit. From those $2,015, Medicare Part B automatically takes $185. You're down to $1,130. Now consider basic expenses. Rent or mortgage. In many areas of the country, this easily consumes $800 to $1,200 per month. Let's be conservative and say $900. You're down to $930. Utilities, electricity, gas, water, trash. Depending on where you live and the time of year, this can be $150 to $300. Let's say $200. You're down to $730. Food. The USDA estimates that an elderly adult spends about $250 to $350 per month on groceries. Let's say $300. You're down to $430. Transportation. Gasoline, car maintenance, or public transport. Let's say $150. You're down to $280. Medications not covered by Medicare Part D or co-payment costs. Easily $100 to $200. Let's say $150. You're down to $130. And this is just the basics. We haven't included phone, internet, clothes, personal hygiene products, uncovered medical expenses, home repairs, taxes, car insurance, nothing. And you're left with $130. Now, what happens when your rent goes up $50? When your electricity bill rises because of a hotter summer? When your car needs a $500 repair? When you need a medication that costs $200 per month? You're broke. Immediately. Here's a devastating fact that few know. Over the last 20 years, the average COLA has been 2.6%. But during that same period, the typical costs seniors face rose much faster. Housing rose an average of 3.5% per year. Healthcare rose 4 to 5% per year. Utilities rose 3 to 4% per year. COLA has never kept up. Never. It's structurally deficient. And with each passing year, beneficiaries fall a little further behind. The Senior Citizens League estimated that since 2000, the purchasing power of Social Security has decreased by 36%. 36%. This means what you could buy with $100 in 2000, now you need $136 to buy the same thing. But your benefit hasn't risen proportionally. You're getting poorer, systematically, year after year. And let's talk about Medicare in more depth, because the problem is even worse than just Part B. If you earn above certain income limits, you pay IRMA, Income-Related Monthly Adjustment Amount. This is a surcharge that higher income people pay. And IRMA brackets are based on your income from 2 years ago, so your 2026 IRMA is based on your 2024 tax return. If you had a large IRA distribution in 2024, if you sold a property, if you had any kind of extraordinary income, you might be pushed into a higher IRMA bracket. And suddenly, instead of paying $250 per month for Part B, you're paying $300, $400, or even $600 per month. IRMA also applies to Part D, so you're paying surcharges in 2 places. And here's the kicker. IRMA is automatically deducted from your Social Security. So you might receive what looks like an increase from COLA, but suddenly your net check is lower because IRMA went up based on income from 2 years ago that you no longer have. The system is full of traps like this. Small rules nobody explains until you're caught by them. There's another aspect that needs to be mentioned, the earnings test. If you continue working while receiving Social Security and haven't yet reached full retirement age, the government can withhold part of your benefits if you earn above certain limits. For 2026, this limit is projected at $24,180 annually, or $2,040 per month. If you earn more than this, Social Security withholds $1 for every $2 you earned above the limit. So imagine, you're trying to supplement your Social Security with a part-time job because the benefit isn't enough. But if you earn too much, they take away part of your benefit. You're trapped. Working more can mean earning less in total. Let's return to the brutal math of COLA versus Medicare. The average COLA increase is $56. The projected Medicare Part B increase is $21.50. This leaves you with $34.50 net, but $34.50 per month is $414 per year. Sounds reasonable? Now consider, inflation in September 2025 was at 3%. If your total monthly expense is $2,000, 3% inflation means you need $60 extra per month just to maintain the same standard of living. You're receiving $34.50. You need $60. You're losing $25.50 per month in purchasing power. Now multiply that by millions of beneficiaries. It's a massive wealth transfer away from seniors. Silent, invisible, but devastating. Some experts argue that COLA should be at least 5% to really keep seniors at the same financial level. AARP conducted a survey and found that many seniors believe they need a 5% COLA to keep up with their real expenses. But the government gives 2.8%. Why? Because CPIW, the index used, doesn't reflect the reality of seniors. It reflects young urban workers who have completely different spending patterns. If the government used CPIE, the index for seniors, COLA would be consistently higher. But that would cost the government more. So they continue using CPIW. It's a political choice. It's not accidental. It's not a technical error. It's a deliberate decision to use an index that systematically underestimates the true cost of living for beneficiaries. And there's another factor that's rarely discussed. Previous COLAs affect future ones. If you have a low COLA in 1 year, your base for the next year is lower. So even if the next COLA is a higher percentage, it's a percentage of a base that was already depressed. During the pandemic, this became brutally clear. The 2021 COLA was only 1.3% because it was based on low 2020 inflation. But in 2021, inflation exploded. Beneficiaries fell behind for an entire year. The 2022 COLA of 5.9% tried to compensate, but by then, many had already consumed their savings. You can't recover what was lost. If you had to use your savings to survive in 2021, a higher COLA in 2022 doesn't give those savings back. The damage was already done. There's something profoundly wrong with a system where the poverty rate among seniors is growing, where people who worked 40, 50 years and paid into the system their entire adult lives now can't afford basic necessities. Social Security wasn't designed to be luxury. It was designed to be a basic safety net. But even that is failing. The net has huge holes, and people are falling through. So what can you do? If you're approaching retirement or already in it, how do you protect yourself from this dynamic? First, understand that you can't depend on Social Security alone. Even with COLA, it's not enough. You need other income sources, personal savings, investments, part-time work, anything. Second, consider delaying Social Security as long as you can. Each year you wait after full retirement age, your benefit increases about 8%. If you can wait until 70, your benefit will be significantly higher than if you start at 62. Third, manage your healthcare costs aggressively. Review your Medicare plans every year. There are Medicare Advantage plans that can offer additional benefits like dental, vision, or even grocery subsidies. Compare. Don't stay stuck in the same plan out of inertia. Fourth, if you qualify for assistance programs like Medicaid, SNAP, or utility assistance, enroll. There's no shame in using programs you qualify for. They exist to help. Fifth, consider reducing housing costs. If you have a large house, it might make sense to sell and move to something smaller and cheaper, or consider having a tenant to generate extra income. But most important, don't accept this as inevitable. Don't accept that the system has to be this way. It doesn't. It's a political choice. Congress could change COLA to use CPIE, could increase benefits, could better control Medicare costs, could do many things. But it doesn't. Why? Because seniors aren't a political priority. Because it's easier to announce a 2.8% COLA and pretend it's solved than to actually face the growing crisis of poverty among seniors. But you have a voice, you vote, and you can demand change. Contact your representatives. Join advocacy organizations like AARP or the Senior Citizens League. Make noise, because if you don't, nothing will change. The 2026 COLA lie isn't that it doesn't exist. It's that it's presented as a solution when in reality, it's just a bandage on a hemorrhage. It's that the system is structurally broken and everyone knows it, but nobody does anything. 75 million Americans will receive that $56 increase, and many will think this helps. But when Medicare takes half, when inflation devours the rest, when healthcare costs continue rising faster than any COLA, reality will hit. And the reality is this: the 2.8% COLA isn't enough. It was never planned to be enough. And as long as the system continues using indices that don't reflect beneficiaries' reality, as long as Medicare continues rising faster than COLA, as long as Congress continues pretending it's solved, millions of elderly Americans will continue getting poorer. Year after year, dollar after dollar. If this content opened your eyes to the brutal reality of the 2026 COLA, you need to subscribe to ChremaDynamics now. We're not just another finance channel. We're obsessed with revealing the truths the government hides, the real numbers behind the headlines, the financial traps that destroy retirements. When you subscribe, you get deep analyses on Social Security, Medicare, taxes, and every system that affects your money. No fluff, just real data and practical strategies. Click subscribe, turn on notifications, join thousands who decided to stop being victims of broken systems. ChremaDynamics. where we reveal the financial dynamics nobody else dares to expose.